Well, welcome to Checking Our Pulse. This segment is being brought to us by Swedish Medical Center and the Northwest African American Museum. And my name is Marcus Hart. I'm the director of the transplant program at Swedish Medical Center. And this is Bertram Johnson, who's the director of the Care Team program at the Multi-Faith Works. And our segment that we're going to talk about currently is HIV/AIDS. So in preparation for this segment, I was looking at some of the statistics. There are about 1 million people in the United States infected with HIV or have AIDS in the United States. But African Americans, although we're 10% of the population, represent almost 47% of the people infected with HIV. How can that be?
Well, the severity for African Americans regarding HIV, there are a variety of factors. I think historically there are still a number of African Americans who live under the notion, this fallacy that HIV was really affecting only gay men, or men who have sex with men. And so under that notion, we've become lax about protection. And so because we didn't feel like we were at risk, more and more African Americans have become susceptible to it. So maybe not using condoms in the way that we should, even with heterosexual partners. And then IV drug use also plays a role in that for some who are involved in those activities too.
Yes, but if we look at sexual activity, can you help us understand the transmission based on what type of sexual activity you're having? So with kissing, you cannot get HIV. That's out.
Kissing does not pose a threat. There's no threat. It would be minuscule unless someone had a severe cut on their mouth and the other person was HIV positive.
Yes.
The primary modes for transmission of the virus would be through unprotected vaginal or anal intercourse.
Yes, but you can get HIV when you conduct oral sex. Is that correct?
There is possibility of that, but again, it would be a severe case of some wound to the mouth, which makes it more susceptible to the virus.
Now, so HIV, though, is a virus. This is a virus that lives in our blood. Is it in our saliva?
It is detectable, but the degree to which it's detectable is minuscule. HIV is found in bodily fluids, so blood and semen would be the two biggest factors for transmission, and also from mother to child during the birthing process.
Yes. Okay, so now help us understand how we can be, African Americans can be 10% of the population, but yet represent 46% of the people infected with HIV.
Well, I think in addition to not protecting ourselves and taking responsibility for our own risk, there are other factors. I think a lack of education and understanding about HIV prevention and treatment. I think also that a lot of folks aren't getting tested. Folks, if you look at the number of African Americans who are living in poverty, who don't have access to medical care, those folks largely aren't getting tested and may continue to pass on the virus out of a lack of their own knowledge about their status.
I see. So now at Multi-Faith Works, what role are you playing in helping people get tested or get information about HIV?
Our organization provides mostly HIV care, but there's an education component about that too. For the last over 22 years, we've been providing practical, emotional, and spiritual support for folks living with HIV/AIDS. We provide housing, education resources so that people who are living with HIV can live healthier, longer, more fulfilling lives. But definitely being responsible, for folks who are already HIV positive, being more responsible with their own sexual behaviors, and also trying to curb drug use or other risk factors that may infect in turn other folks.
Yes, and there's still this stigma about HIV. So if you have influenza, if you have other viruses, you feel free to talk about that. But if you have HIV, people still don't want to have the conversation, and that's kind of what we need to have here, is a conversation about, well, if you don't have it, you should still use a condom when you have sex. Never have unprotected sex, and you should get tested if you're uncertain about your status. Is that correct?
Definitely. I think the issues of stigma and fear significantly influence the way that African Americans respond to HIV. It's that sense of not moving forward and taking responsibility for ourselves that really causes us to be at risk. So everyone out there should get tested. Everyone should use a condom whenever you're having sex with a partner whose status you're not familiar with.
Yes.
And also just take greater responsibility for your health overall. So see your doctor. There are other contributing factors that always make a person living with HIV, or make us more susceptible to HIV.
Well, thank you so much for joining us. And this is this segment will be aired as part of the celebration of African American contributions to medicine at the Northwest African American Museum. And this will go on until June of 2011. Thank you.